Hello, everybody. We are going to perform a coronary sinus reducer implantation today. Dr. Konigstein will perform the procedure. My name is Banai. I'll be helping. We have a 60-year-old patient with severe obstructive coronary artery disease who underwent many revascularization procedures previously. He has a diffuse disease distally and no option for revascularization. He suffers from angina at minimal effort, CCS class 3. We have already started the procedure by setting up the room, as you see, and inserting a 9 French sheath into the right jugular vein. We did the sheath insertion with the guidance of ultrasound. And now we're going to start the first part of the procedure, is that we are going to insert a 6 French diagnostic multipurpose catheter into the right atrium, flush it with saline, and measure the mean pressure in the right atrium. So, if you can please show us the fluoro as well. We are in the right atrium. Okay, and we're going to measure mean pressure. If the mean pressure is higher than 15, we will abort the procedure. Okay, so we flush, we zero, we change the scale to a scale. Give me a flash, please. 0, please. And we'll take a scale of 25 or 50. Pressure. So the mean pressure is around 5 to 7, which is good. That's enough. Thank you. And now we will take a Luer lock syringe with pure contrast. And Marianne here will try to engage the coronary sinus ostium. As you see, we're going in without a wire, just with a multipurpose. Our second choice is Amplatz left 2. The first choice is always multipurpose diagnostic 6 French catheter. We are trying to go from 11 o'clock on the screen to 5 o'clock, making small rotations. The clue that you are engaging the coronary sinus is that the tip of the catheter is passing the vertebra and crossing to the other side of the vertebra. Otherwise, you are still in the right atrium or in the right atrial wall. It's recommended to give little tests of contrast to see when you are engaging the ostium of the coronary sinus. This part of the procedure, engaging the coronary sinus, may take a few seconds to 15, 20 minutes sometimes. Sometimes it's very easy, sometimes it takes some time. You have to do it slowly. When your catheter is getting into the right atrium through the tricuspid valve, you see a lot of VPCs, premature beats on the screen, so you're backing up. I think you were in. Try again. So we're going up and down, rotating, and trying to find the ostium of the coronary sinus. Give a little test. I think you're in. Here, we are in now. So what Marianne is doing is trying to advance slowly the catheter only by rotating it, not pushing it, just rotating and going up. I'll move the screen a little bit. You go up as much as you can without a wire. If you are engaged into a valve that prevents you from advancing the catheter, what we do, and the clue is that the catheter at 6 o'clock becomes straight. You don't want it to become straight, and you don't want it to bulge into the into the right atrium. So you're stuck there. Let's take a wire and go up with a wire, okay? We take a long exchange J wire. we haven't given heparin yet. Only after the angiography and the decision to go ahead and perform the implantation, we give the heparin. Take the catheter a little bit backwards. Okay, so you see the wire is going all the way up to the great cardiac vein, and now on top of the wire, I'm holding the wire, my hand is taking the catheter all the way up, and I'm taking the wire out. So now, next step will be to take a full angiography. Every time before we take a full angiography, we give a little test to make sure that the tip of the catheter is not in a small branch, because if we'll take a forceful injection into a small branch, we might break it. So we make sure that we are not in a small branch, and we take a full injection, full angiography. Okay. Now this is a pretty big coronary sinus. The diameter is big, so it might be borderline for reducer implantation. David, could you please do QCA? So the QCA says between 9.5 and 7.5. Okay, so it's fine. You can take off the QCA. We'll go ahead with the implantation. Take it away. Okay, we are going to proceed. According to the QCA, the diameter of the coronary sinus at the site of implantation is going to be between 8 and 9 millimeters. We need to oversize the reducer at the site of implantation. I'll show you later how we do it. So we choose now a bony marker, and our bony marker will be this intervertebral disc, about 2.5, 3 centimeters from the ostium of the coronary sinus. We will place the center of the reducer on this intervertebral disc. So the next stage was to give heparin. We gave full heparinization to the patient. And now what Marianne is doing is inserting the J wire inside the multipurpose diagnostic catheter and get the guiding wire as far deep into the great cardiac vein, and we're taking out the multipurpose catheter. So the multipurpose catheter is out. לא לזוז בבקשה. We will need the multipurpose again, so I flush it with saline and I keep it in the water. And now we will open the whole system. Gilly, please. We use the Acuity Catheter, which is a dedicated catheter for coronary sinus. That's the Acuity Catheter. Okay. Two things that we have to remember. First, you flush the catheter outside and inside. This is important. And we break the one-way valve with this green dilator that comes with the catheter. Do it several times. Otherwise, there will be a lot of friction when you insert the reducer, and this valve might move the reducer. We don't use the other equipment that is on the tray. So we have the Acuity Catheter. And now we take the reducer. The reducer comes in a protective plastic tube sheath. We take it out. And then it has another protective tube on the reducer and a metal membrane which we take out. And the protective tube we take out. We check that the reducer is between the two markers. And there is an additional third most proximal marker to which we will withdraw the guiding catheter at the end. So now I flush the inner lumen of the reducer. It is flush and we keep it on the table. Next thing we do is we prepare the Deflator. The Deflator will contain a solution of 20% contrast, so I take 2 mL of contrast and fill it to 10 mL with saline. So in the syringe, in the 20 mL syringe, I have 20% contrast, 80% saline, and we suck it all into the Deflator, and we keep the 3-way stopcock on the Deflator. We will need it at the end. You'll see why. So the Deflator is ready. Acuity Catheter is ready. We have the wire inside the coronary sinus. What we do now, we take the multipurpose, we put it inside the Acuity Catheter, the guiding 9 French Acuity Catheter. The multipurpose is longer, so it extends outside the tip of the Acuity Catheter, and we place it over the wire. So the multipurpose is going over the wire, which is in the coronary sinus. I'm waiting for the wire here at the distal end, and I hold the wire with some tension while Marianne is inserting the multipurpose over the wire. You'll see now the multipurpose coming to the right atrium. I keep some tension on the wire, it's very important. The multipurpose is going inside the coronary sinus. Again, never push. Just rotate and wait. You have to cross the valves of the coronary sinus, and she will take the multipurpose as far as she can take it. Wait a second, Marianne. Now, both the multipurpose and the wire are in the great cardiac vein. I'm holding both of them, and she's advancing the guiding catheter. You see the guiding catheter is coming down now to the right atrium. All she does is rotating. Now, go into the coronary sinus slowly with rotation, as less pushing as possible, just rotating and let it go in, riding on the catheter, on the diagnostic catheter. That's very good. And go with the tip past the point of desired implantation, which is perfect now. So now we are in place. The tip of the guiding is beyond the place that we want to implant the reducer. So what I'm doing now, taking the multipurpose out, leaving the wire and the guiding catheter in place. Okay? Wire in place, multipurpose coming out. Very important not to lose the wire position. Okay. So I'm taking out the multipurpose. Again, I'm flushing it, putting it in water, keeping it in the water, because we will need the multipurpose again at the end of the procedure for the final angiography. So I do flush it now. And keep it in the water. Okay, so now we are ready for implantation. We take the reducer. Without touching the metal of the reducer, we're placing it over the wire. I'm waiting for the wire at the distal end of the delivery system. I have the wire now, so I keep the wire on the table with some tension. Now, when Marianne goes with the reducer through the TUI, it has to go smoothly without any friction. So you go in, and when she arrives with the reducer to the level of the right atrium, we stop, and we take a cine. This is very important to make sure that the reducer hasn't moved on the balloon, and it is still located, well located between the markers, which is the case in our case. So now, look what we see the guiding wire deep in the great cardiac vein. We see the tip of the guiding catheter distal to where we want to implant. And now under Cine, Maayan will advance the reducer to the tip of the catheter and a little bit past the desired site of implantation. Okay, go ahead. Go ahead, that's good. Okay. Catheter out a little bit. Catheter out. Okay. Now both of them, both catheter and reducer, distally. That's perfect. Okay. That's okay. We're fine. So now we are ready for implantation. We are exactly at the site where we want to implant. I now connect the three-way stopcock of the Deflator to the reducer delivery system. We don't go negative on the Deflator. And now what Maayan will do is in one smooth motion, we'll take the guiding catheter back, withdraw it to the most proximal marker on the delivery system, leaving the reducer exactly at the place we want to implant, which we have a bony marker, the intervertebral disc, while I will try and keep the wire in place. Ready? We'll do it under Cine. Go. All the way. Great. Okay. You can pull everything. Oh, it's okay. Let's inflate. Okay, I'm inflating to 4 atmospheres. Perfect. Okay, now, while waiting for this to be steady on 4 atmospheres, we'll take a syringe with contrast, and we will inject some contrast through the guiding catheter to make sure that we are oversized enough. Cine and inject. Okay, we are slightly oversized. I can go up to 5 atmospheres now, which is a little larger diameter. We can do another injection to see that we are oversized. You don't want to see contrast going around the balloon distally into the coronary sinus. Oversizing is very important. Okay, that's fine. When the Deflator needle is steady on 5 atmospheres for 30, 40 seconds, we can withdraw and go to negative. Now, this is a big balloon, and probably the most difficult part of the whole procedure is to withdraw the balloon without moving the reducer with us as it goes with all the wings through the narrow center of the reducer. So that's why we take extra time to make sure that the reducer balloon is fully deflated. So what we do, that's why we keep the three-way stopcock here. What we do, we use the stopcock to completely empty the Deflator and then take another negative, and we will also take a third negative. We also take saline and flush the guiding catheter to get rid of all the sticky contrast. Again, this is our third negative. Take a Cine, please. Okay, what we see now is the reducer exactly at the place we wanted it to be implanted. We see the wire is in place. We see the 2 markers at the proximal and distal ends of the balloon. The next part will be to take out the balloon, withdraw the balloon without moving the reducer with us and without losing wire position. So the way to do that, We don't need the Deflator anymore, so we keep it here with this three-way stopcock on negative. And what Maayan will do now, she will start withdrawing the balloon with her right hand, while with her left hand, she will allow the guiding catheter to go distally, and the tip of the guiding catheter will support the narrow center of the reducer, keep it in place while she's pulling out the balloon. This is a stage where one can easily lose wire position. So my role is to keep the wire in place while she's using the left hand to advance the guiding catheter, the right hand to withdraw the balloon. As soon as the balloon will be in the right atrium, I will push on the wire so the guiding goes back, leaves the center of the reducer, and goes back to the ostium of the coronary sinus. We have to work simultaneously. Think together, look together, and breathe together. Okay, go ahead. Okay, go. Pull out. Pull out. בסדר, הכל בסדר. Everything looks good. Why? Wire. Wire. Just a second. Wire is in place. Yes. We take the balloon out slowly. Hold on a second. I need some wire here. Wait. Okay. יש לי פה התנגדות שנייה. Wait a second for me. She is working too fast for me. Okay. The balloon is out. We flush the wire. And now we will take, for the last time, the multi-purpose catheter, put it over the wire, go through the reducer, and distal into the coronary sinus. So again, I'm waiting for the wire at the end of the multi-purpose. I give some tension on the wire, while Maayan is taking the multi-purpose into the coronary sinus through the guiding. Goes through the reducer, up into the coronary sinus. At this stage, I take out the wire. So now we don't have a wire, and we're going to take the final injection. Again, before taking the final injection, we test that the tip of the catheter is not in a small branch. You can go back a little bit. Okay, take the final injection. Okay, this is a perfect result. As we see, the reducer is exactly where we wanted it. You see oversizing of both ends of the reducer, proximal and distal end. Oversizing is important because it will trigger tissue proliferation that will cover the struts and the gap between the struts on the reducer, establishing the narrowing. What Maayan is doing now is withdrawing all the system. We see the reducer in place, and actually we are done. We will keep the sheath in the neck for another hour and then take it out. The patient is on aspirin and Plavix for 6 months. Patients who are on NOAC will be on Plavix and NOAC. That's it. You have any comments? No? We're fine. Thank you very much.